So today I want to talk to you about vertigo. This is an important topic. I'm not going to do a very deep dive. I'm just going to talk briefly about what it is and what you need to know and what I see, the trend I see in the clinics every day that surprises me. All right, so vertigo is an abnormal sensation of spinning or tilting or swaying. So there has to be some form of sensation of movement, which isn't there really. So that's a kind of, would I say, hallucination of movement. So an individual is sitting down and suddenly feels like they are, tilting or they're moving or the environment is tilting. And a very common sensation is some people feel like the environment is spinning. And one of the most, graphical description one of my patients has ever given me was a sensation of, an earthquake happening, and I actually couldn't stop myself bursting into laughter right there in the clinic when the patient was describing it. It was so vivid, and they were like, "Doctor, honestly speaking, it was so terrible. I felt like there was an earthquake." Just some patients are so expressive, they are able to express exactly what they feel. So a lot of patients come to the clinic and they give this description of a sensation of spinning or twirling around or some sort of that. And when you examine them or take further history to find the cause and you tell them their diagnosis, and the response I get sometimes horrifies me, and that's why I want to talk about it. So some patients find it so difficult to accept what their diagnosis is because they've consulted Dr. Google, which is a very, very terrible idea, actually. Dr. Google is a very terrible doctor. And Dr. Google has told them they've got vertigo. And then they come in and whatever diagnosis you give them and treatment you give them, they refuse it simply because they believe that what they have is vertigo. So there's nothing really special about vertigo. So vertigo is just a symptom. Imagine you're going to a doctor and saying you've got a cough, and the doctor tells you at the end that your diagnosis is cough. That would be laughable, isn't it? Because cough is a symptom of something. Your doctor would either tell you, after having listened to you, examined you, or tested you, that they think you've got a pneumonia, or they think you've got upper respiratory tract infection, or you've got a flu, or you've got an asthma, or whatever. That's a more clever diagnosis which is treatable. So, and some patients come and say, "Doctor, don't you think I have vertigo?" And I'm like, gosh, everything you've described to me is vertigo. So but that means nothing. Vertigo is simply a symptom caused by something. So in my practice so far, I don't know what the literature says, but in my own practice, I have two competing commonest causes for vertigo. One of it is migraine. Migraine is, an extremely common cause of vertigo, and we call that vestibular migraine or migraine with vestibular symptoms. So it's a very, very common cause. And the other common cause is what we call benign paroxysmal positional vertigo. That's a bit of a complex name. For short, it's BPPV, when you have some crystals being dislodged in the inner part of the ear. There are so many other causes for vertigo that we're not going to talk about today, but so far, by far, the two commonest causes are, vestibular migraine and then BPPV. So the reason I made this video is just to, enlighten people about this condition and make you understand that vertigo is not a diagnosis, for God's sake. Thank you for watching. I hope you learned something. Do not forget to subscribe and share, leave your comments behind and like the video. Thanks for watching. I'll see you in my next video.